डबल चिन को डबल चिन क्यों बोलते हैं?
You're looking at your phone and suddenly you're like, "अरे ये कौन है?"
It has become more popular during this COVID era.
For a second, I thought you were going to say face yoga.
So early morning Zoom, not a good idea.
Right.
So when we are young, it's nice and triangle.
Yes.
Then the triangle becomes square.
Yes.
And the square becomes a pair.
Hi everyone. On popular demand after our last episode on liposuction, which did really well, thank you guys for all your likes and questions. Let's sort of dive into this really hot topic that we have, which is the double chin. Whether or not people have it, उनको दिखाई ज़रूर देता है double chin, either because you're looking at your phone and suddenly you're like, अरे ये कौन है? Right, so let's talk about why double chin happens and how we can sort of address this issue.
Double chin को double chin क्यों बोलते हैं? Why it is called double chin?
I mean, एक ये दूसरा
वो.
ये.
So double chin is
Yeah.
basically developing another chin below
Yeah.
the chin,
Right.
which is because of fat or sometimes even fluid accumulates there that forms. And like you said, it has
Yeah.
become more popular, during this COVID era when people started looking at themselves while zooming, or while doing online meetings, and they've realized that it's a problem now.
That is true. I mean, that is one of the reasons why selfie का most favorite angle is ऊपर से और ऊपर से और ऊपर से बिल्कुल ऐसे करके. Yeah, that is true.
Yeah.
That is true.
So yeah, double chin is a common problem now. Okay, and the good thing is there is a simple solution for it. Which is liposuction. Liposuction really works very well for double chin.
For a second, I thought you were going to say face yoga.
Yeah, that's what. but
Yes.
sometimes I do advise the patient do that. So what happens is many times it's not fat. It's just because when they're bending, obviously the skin will fold a little bit.
Right.
And then that bothers them a lot. And when I look at them, I see that there's hardly any fat.
Right.
And very interesting, they will notice that more when they wake up in the morning, and it will become less in the evening. That's a very interesting fact. Why? Because when they lie down, the fluid ascends in the body and gives them that puffy look. So early morning Zoom, not a good idea. Late evening, the body drains out the fluid, you look more slimmer.
Right.
So that's where I realized that facial yoga, yes, it does benefit. When you do massage, when you do facial yoga and use muscles, it drains out that fluid. And another trick is, if you have a party or if you're zooming in, doing a Zoom meeting next day, wear a chin strap overnight and you will look chiseled.
I think this completely sort of busts the myth about a nice beauty sleep when you wake up fresh in the morning. I think from now on, let's do all of our online stuff in the evening or walk around with this chin strap. But I mean, despite the fact that the chin strap will help improve lymphatic drainage, but जो ज़्यादा बर्गर खा रहा है और उसकी वजह से उसके बर्गर लटक रहे हैं, that fat is not going to vanish on its own.
Yeah. So that's of course a problem of overeating and weight gain, where the fat starts developing at the bottom. So what happens is as we age, the fat starts depositing in the lower part of the face. So that causes double chin and changes the shape of our face.
Right.
So when we are young, it's nice and triangle.
Yes.
Then the triangle becomes square.
Yes.
And the square becomes a pair. So that changes happen because of accumulation of fat and all of these changes. But yeah, so what we do in there is a technique now, it's called endo lift, which is using a laser.
Right.
That is done from just a small tiny hole underneath here. It goes underneath the skin and it breaks down the fat and melts the fat. And also tightens the skin. Obviously that is not enough, so we have to do a micro kind of a small liposuction to remove that fat. And that gives fantastic results.
How much of a downtime is involved in a double chin liposuction?
So double chin, you usually need to stay away from people for about, let's say, 4 or 5 days maximum. Many people, they go out with masks. So when you see people out with masks, not necessarily mean they are worried about COVID. There could be other factors as well. But yeah, for 4 or 5 days, sometimes it's a bit challenging. You may feel conscious about swelling and all. But after 5 or 6 days, you put makeup, go out, you look just fine.
So it's a good
And the
time
result
to
gets
wear
better.
turtlenecks.
Oh, absolutely. So, you can use all your creative ideas to cover that up.
Winters.
Yeah.
This winters,
Yeah.
get rid of your double chin. Yes, and then you were saying that, once they, the first 4 or 5 days post that, the swelling reduces, what can they expect after?
So then they see that the double chin will become less, they'll have a nicer jawline, and it keeps on improving over a period of time. So it takes few months really to give them a good look. But I do encourage them also to then get back on exercise. There's no escape from exercise at all. You have to get back, and that improves the result. Because you then start losing some of the other body fat, that motivates them, and then start working out. It improves the muscle, it improves the structure, and overall, then they enjoy the result more.
But there are also so many non-invasive ways, so to speak, of to reduce double chin. Would you go ahead with a liposuction for somebody who's got double chin, fat removal surgery, or would you choose to dissolve their fat using fat dissolving injection?
Yeah, I used to do that in the beginning. I've tried all kinds of these modern injections, oxycolic acid and deoxycholic acid and amka and amka. But I've realized, honestly speaking, time and cost effectiveness is better with liposuction than with non-surgical and a double chin problem.
True. Would you say this is like the lunch hour procedure of all plastic surgery?
It is absolutely a lunch hour procedure. Just local anesthesia, quick procedure, and they can walk out and they can go back home.
How much time does it an average?
It takes about an hour and a half tops.
That's it?
That's it.
So in my lunchtime, I can literally go get my procedure done and come back?
Absolutely. Yeah.
Wow. And overall, what kind of effect does that have on the skin as well? So skin tightening also happens as a result of the surgery, or do I have to?
So once, of course, it also depends on the quality of the skin and how big is the double chin, how big the burger you ate before. So all of those factors are there.
If it's McDonald's, or if it's
McDonald's,
Burger
or if
King.
it is the giant one. But if the skin quality is good, with the effect of laser that we do and the removal of fat, it lifts up.
Right.
But if age is not on your side, and if really it's a big double chin, then obviously you need some extra help other than just removing the fat.
Right.
Like, ultrasound treatments or like external treatment that will improve the quality of the skin and improve the result.
So energy-based devices like HIFU.
Absolutely, we'll work on them. Absolutely.
Radio frequency.
So I do sometimes recommend. So sometimes what I do in these people, I do the lipo. Immediately I do put threads inside to support the neck. That also helps. And do some Morpheus or radio frequency treatment either immediately or after a few weeks.
Okay.
So sometimes you have to attack from all the sides to be able to get a good lift without doing surgery or lifting or doing actual surgery.
I mean, a good aggressive approach towards any condition is the right way to go.
Absolutely.
Because ऐसा कभी नहीं होता कि एक सिंगल कंडीशन को मैं एक तरीके से अप्रोच करूँ तो सडनली मुझे आंसर मिल जाएगा.
Correct.
Like for anybody who's ever thought, or even who knows about how difficult it is to try and lose weight, knows this कि ऐसा नहीं है कि मैं सिर्फ खाना कम करूं but exercise ना करूं और पानी ना पीऊं और टाइम पे ना सोऊं, suddenly I get results. You have to attack it from all possible directions, and that is called an aggressive approach, and that gives us the results that we want. Coming back to one of the things that you actually said is that cost and results से अगर हम देखें, a non-invasive procedure doesn't give us the kind of results we want. But does that also mean somebody who's not committed to the process of reducing weight or maintaining weight would, कितने भी non-invasive procedures करा ले, they will always be dissatisfied because constantly their body is gathering fat, and क्योंकि उनकी double chin की tendency है यहाँ पे fat बार बार आता जाएगा.
So it depends. If the problem of double chin is because of general overweight and obesity, that needs to be addressed first.
Okay.
And sometimes addressing that will improve that.
Right.
But there are situations where people are average body weight or slightly overweight, yet they have double chin. Those are the difficult situations. Because then they have to lose so much that they really become, look gaunted. Exactly, kitschig, to be able to correct that. Yeah. So sometimes those people have those challenges. In such situations, it helps.
उनको Halloween के लिए costume की ज़रूरत नहीं पड़ेगी.
Yeah.
Just kidding. But So localized area का liposuction, that is what I believe that it means, right? For people जिनका stubborn fat सिर्फ एक particular local area के अंदर है and the rest of the body में कुछ भी नहीं है.
Correct.
So local area के अंदर liposuction definitely benefits them. उसका डाउन टाइम बहुत कम है, उसका रिकवरी रेट काफ़ी फास्ट है, उसका satisfaction rate is also amazingly good, right? That's what
Sometimes,
I understand.
even in, it's very interesting, and I've done this before for people who are really, really overweight and obese, because they look at themselves every day and they feel depressed when they look at that big chin and big face, even if the body is covered. So that gives them a very disappointing time. That's very disappointing for them.
True.
So once we remove that fat, it actually changes the perception, and they feel, wow, now I need to work out and take care of the rest of my body. So it really depends on how you are approaching that problem.
It's a very commonly said statement, beauty inside out. But you brought me to something very recently that happened with me, and I was talking to one of my patients about this. I said sometimes the healing begins from outside in. You look at yourself, and looking at yourself, having reached where you wanted to, you start feeling it, you start believing it, and then you get the motivation because you're giving yourself that motivation. Sometimes visualizing where we want is not possible for everyone. So seeing it and believing in it, and then it starts happening.
Yeah, very well
as well.
said.
Yeah, so sometimes, guys, healing begins from outside in as well. It's not always beauty inside out. So chest lipo, I mean, this is obviously something that only men have to undergo. For women, though, I'm pretty sure you're either. It is.
But it's very interesting. In women,
yes,
we don't, of course, do in the breast area, but we remove the side breast. The breast
yes.
that's underarms.
The axillary tail.
The axillary tail.
Yes.
So we do also liposuction in the bra roll area. That improves that area. And you know why it's called bra roll? Because of the damn bra. And unfortunately, let me tell you, all the designs of the modern or the olden bra is wrong. That is not helping women at all. Because it has strap which is thin, and that thin strap constantly applies pressure in one area and forms a groove, and the fat accumulates above and below that area.
Right.
I think somebody seriously needs to redesign that bra.
I think you should give us some suggestions on what is the correct one, because if you think about it, the sports bras these days, they focus on making
broad
sure
band. I think they are better.
Strap,
they are much better.
And the support is better and everything, and the shape is much better.
Yeah.
But the more thinner bras that you wear, it completely takes that away.
Correct.
So coming back to the side breast removal. So who are the women who end up developing, excessive just the side breasts?
So one is, of course, genetically, some people may have that. Even if they are very thin, they may have, accessory breast gland. So that's one condition. But it's often related to weight, with the weight gain, with the pregnancy changes, weight gain. People not only accumulate weight in the tummy and the waistline, but also in the axilla, that makes the shoulder look broad, or the upper body looks broad. This is very typically also called as male pattern fat deposition or android obesity.
But is that different from people who develop a tendency to store fat in their back and upper shoulders?
So it could be a combination of that. So there could be women who are more android, where the upper part of the body is heavier than the lower part of the body.
Okay.
That's called as android obesity or overweight. Or it could be without the back and the shoulder area. It could be just in the axillary area or underarms. Where they still have a feminine feature or gynecoid kind of body feature, but they have fat only on those specific areas in the bra roll.
So in that patient, you will just remove the fat in that area?
So you can just customize it and to improve the proportion of the body to address the problem that is causing the disproportionate issue.
So what are the different kinds of parts of the body जिसमें you can do localized lipo? I mean, one we understood is कि ठीक है body waist वगैरह जिसको आप 360 lipo बोलते हो, but apart from that, what are all the other?
Another common problem that many people have is the back hump. Hump in the back. That also is a problem, and sometimes that can be so severe that people have posture issues, or they even get neck pains because the position of the neck is abnormal, and they start getting migraine.
Isn't there a name for this hump? Camel
Camel
hump.
hump. Exactly,
Camel
like a
hump,
camel.
right.
Yeah.
You're
So
not in a
even
desert,
that-
but you're
yeah.
a camel.
Even their liposuction can help and improve that significantly.
Right.
And I have seen people actually relieved of shoulder pain just by doing that liposuction in that area.
Wow. So camel hump is one. Back, you said, just so somebody who's developed fat in just their back, are they good patients for localized lipo, or would they require 360 lipo?
So it all depends on the extent of fat deposition. I mean,
Right.
many people just do in the roll area, or they'll just have rolls. You can
Right.
improve that, or others may have more generalized fat deposit, and you can improve that as well.
Some people have, like, love handles.
Love handles, exactly. Then sometimes a little settled bags.
Right.
Some people may be skin and thinny, but they still have that settled bag, or they may have just pockets of fat in the inner knees.
Right.
Inside the knee, or some people may have wider ankle called cankles, which
Yes.
is an ankle that is similar to the size of a calf, of the calf. So calf and ankle looks like one structure. That's called cankle. So you can actually remove the fat in that area and
Yes.
sculpt the calf and
I
leg as
wonder
well.
who keeps
So-
coming up with these terms.
Yeah, absolutely. There are creative minds
Very
everywhere.
creative minds. Cankles, right. So, have you done a lot of cankle procedures?
A lot of cankle procedure. It's really very rewarding both for patients and for us as well.
Was the patient able to keep their face straight when they said, I need a cankle surgery?
Well, most of the people don't know that's called cankle.
Right. So, are there other pre and post precautions for localized lipo the same as if somebody wants to go for a 360 lipo? Yeah, for
No, it's easier. It's easier. It requires less preparation,
Okay.
less aftercare, quicker recoveries. It's much
Right.
easier.
Right. So, when is an ideal? Is there an age limit for somebody who wants to undergo localized lipo or gynecomastia or some procedures
So
like this?
obviously, one needs to be a fully grown person. Let's say it's not done below the age of 18 to 20 years.
Right.
Secondly, the health is important more than age.
Yeah.
A person who is old enough but good health and wants to look good,
Huh.
definitely it can be done. But if there are medical issues that requires more priority, then obviously we don't recommend that.
Right.
So all of these factors, age limit, health factors, and what is the problem that particular issue is causing them, all of this needs to be considered.
So overall, localized liposuction is a very rewarding procedure for both you and the patient, because we're sort of hitting one problem area, we're getting to that problem area, and because that problem area is now solved, everything else, it's like a puzzle that fits together.
Correct.
You've taken that away, that one piece that wasn't fitting, and now suddenly everything fits together, and it's a good outcome that you're experiencing. So any area that you do liposuction in, there is, I believe, a shapewear or something that they have to wear.
Yes, they have to. Yeah, because you need to allow the skin to shrink back.
Right.
So you need support.
So
for that.
shapewear post any liposurgery is an important step of the
It's an important
aftercare
step.
procedure.
Yeah.
And how long do they have to wear the?
So it depends on the area of the body. Some areas where the skin shrinks faster
Right.
does not require long. For example, the hump of the back doesn't require. Even if you don't wear shapewear, they do very well.
Okay.
Yeah.
Yeah.
But where the skin is thin, like the tummy, requires more support for the skin to
Right.
shrink back.
Right. I think a lot of patients in general are hesitant about कितनी देर तक करना पड़ेगा. And it's important to understand आप जितनी देर तक उसको करोगे, the better your results would be.
Yeah. That's
Because with age, our skin is also aging.
Amazing.
And actually, if we wear clothes that help sort of keep the skin in place, like how the spandex gym jo
Yeah.
athleisure wala look
Yeah.
hai,
Yeah.
that athleisure look, apart from being really good for just Nansuk Prapti,
Yeah.
it's also good for the skin
Support
in
of
general.
the skin. Yeah.
So yes. And overall, is there anything in a localized liposuction that a patient should know before they decide to go ahead with it, or that there's no specific?
So again, the
precautions
same
that
thing.
is
First, they
required?
need to understand whether it's going to help them or not.
Right.
They need to do the consultation, get their health checkup, and then plan it.
And then that's about it.
That's it. Yeah.
And there's not
Very
a lot
simple,
of preparation involved.
Quicker procedures, less risks.
Right.
Less downtime.
Right.
All of those things.
Definitely. All right. Thank you, Dr. Sanjay. This has been
Thank you.
lovely. Guys, If you liked this video, make sure to like, share, and subscribe, and I will see you soon.